Hello, and welcome to this short presentation introducing you to the Children and Young People's Nursing Programme at Bangor University. My name is Awelwyn Williams, and I'm part of the Children and Young People's lecturing team. Croeso mawr I chi gyd, welcome to you all. This year, we are welcoming our new validated programme, and we are excited to provide a current, innovative and modern course for our future children and young people's nurses. The programme runs over 3 years and is a full-time course. The new curriculum provides opportunities to work on an interprofessional level that has not been explored before. And this means that for parts of the course, you will be joining students from many other health professions, such as adults, mental health and learning disability nurses, medical students, physiotherapy students, and radiography students. A Children and Young People's nurse cares for children and young people of all ages, from a neonatal baby to an adolescent, and they have a range of physical, emotional, and mental health needs. This means that not one day is the same and provides an opportunity to specialise in the most specific of areas or work in a broad, ever-changing environment. The Children and Young People's nurse role is highly rewarding and can be challenging in today's fast-changing healthcare environment. The programme consists of 50% theory and 50% practice. The 50% theory relates to lectures, seminars, tutorials, and self-directed study. There is a blended learning approach so that students can learn about other fields and multidisciplinary team working. The course for Children and Young People's Nursing is based at the Wrexham campus. Here, we will also provide clinical skills training with innovative use of augmented technology, clinical scenarios, and hands-on skills practice. This ensures that you can practice practical nursing skills in a safe, friendly, and encouraging environment before you step into a clinical area with real patients and families. The Children and Young People's Nursing team have a state-of-the-art, highly realistic mannequin that meets specific learning objectives, and it focuses on initial assessment and treatment. This simulation baby is designed to simulate varying clinical signs and symptoms, and that will allow students to develop an ability to recognise, respond, and treat the deteriorating patient. The 50% practice will be based on a placement in a clinical area, and this will be supported by registered nurses who will be known as your practice supervisors and practice assessors. Placements are carried out across the 3 years in a range of clinical areas, such as hospitals, special care baby units, hospices, mental health services, community children's nursing teams, health visitors, school nurses, and specialised paediatric intensive care units in England. Services that care for the child and young person and families in North Wales cover a large geographical area, and many different specialities go hand in hand with this. As a result, you will encounter children, young people, and families from a variety of backgrounds and have the privilege of caring for them, forming professional relationships with them, and treating them therapeutically. Throughout your 3 years of study, you will be supported by various members of staff and services at the university. Your personal tutors will follow your journey along the programme and are available to provide appropriate, individualised pastoral support to ensure professional development, a good student experience, and facilitate academic success. All the personal tutors are passionate about maximising your learning, reducing your stress, and encouraging professional growth. You will also receive academic support from all staff at the university. We have a fantastic and comprehensive student support service that can help with a multitude of aspects that may affect your personal or your professional life. The lecturers and lectures are based in Wrexham campus, and there is a library here with a specific health focus. The library staff are a fantastic resource for your studies and are always there to help. You will also be supported by your peers. The Childfield team are a small and close-knit group and therefore you will feel a sense of togetherness and mutual respect. We sincerely hope you will make lifelong friends at university, and they might even become your colleagues in years to come. Children and young people are constantly changing and developing, and as a result, as their nurses, we need to adjust and adapt the way we care for them dependent on their needs. Communication is central to all healthcare professionals, and this is taken to a greater, unique level when caring for a child or young person. The nurse is constantly assessing the patient, physically, mentally, and emotionally, and this requires a breadth of skills and an observant, patient-focused attitude. People choosing a career in nursing make a real difference to people's lives. Nursing is highly rewarding, constantly changing and growing, and is an exciting profession. Bangor University offers a range of exciting and comprehensive learning experiences. They are one of the leading universities in research, providing research-led teaching supported by high-quality research programmes. These programmes are transforming the quality and delivery of healthcare in Wales and also internationally, and this ensures that your study is up to date in theory and in practice. There are also opportunities for students to study theory and experience clinical practice in a bilingual environment, giving you the skills to deliver clinical and social care in a unique context. There are challenges during this programme, and they will continue throughout your career. You will encounter diverse clinical experiences, and this can vary from a busy accident and emergency department to a children's hospice. There will be times where you will be expected to complete assignments whilst you are on placement, and shift patterns will vary depending on the area that you're practicing in. It is expected that students mirror the same shifts as their practice supervisors and assessors to ensure that they get the most out of their placement and receive high quality support. Students are expected to travel up to 90 minutes to placements. However, there are travel expenses support and hospital accommodation is made available. And this is to allow students to stay closer to their placement if they so wish. Working with children and young people and their families can be emotionally demanding and difficult at times. We are absolutely dedicated to ensuring that your mental health and well-being is continually safeguarded. And there is a great focus in the new curriculum on resilience and mental health awareness. Children and young people's nurses have the privilege of caring for children and families from all walks of life. The career opportunities are endless. You can become a children and young people's nurse in an acute hospital environment or an intensive care unit, or you can care for babies in the community as a health visitor, or older children as a school nurse. There are many different types of community teams specialising in a range of long-term conditions and caring for families in the home environment. The Children and Young People's Nursing Programme is a competitive course with a limited number of places each year. The interview process works closely with our practice partners, therefore it includes staff from the Health Board. The interviews incorporate a values-based approach, and the group activities are designed to explore your knowledge about children and young people's nursing. We also want to explore your ability to think critically, evaluate your communication skills, and evaluate your ability to work as a part of a team. Applications are received through UCAS, and the academic entry requirements for the programme is tariff-based and requires 112 UCAS points and a C or above in Maths and English GCSE. It is essential that all applicants obtain a satisfactory disclosure and barring service check before commencing any of our undergraduate healthcare programmes. All applicants must satisfy a range of entry criteria demonstrating good health and good character. In addition, before commencing the programme, all candidates will be required to complete an occupational health questionnaire and attend subsequent appointments to receive their vaccinations or medical care that will allow you to work in a clinical area safely. Our hope at Bangor University is that we encourage students to be compassionate individuals that demonstrate empathy and kindness. Kindness is central to the Children and Young People's Nursing course, and this involves kindness to each other as colleagues, to the patient and family, and also to yourselves. Intelligent kindness is a creative and problem-solving force that inspires teamwork and focuses the imagination and goodwill. Intelligent kindness is more relevant today than ever before, and being kind directs the attention and efforts of people and organisations towards building relationships with patients, recognising their needs and treating them well. The Childfield team are extremely enthusiastic about the Children and Young People's Nursing programme at Bangor University and come from a variety of nursing backgrounds. And this involves health visiting, community nursing, large acute paediatric intercity units, neonatal intensive care units, and also international nursing. We sincerely hope that our skills, experience, and enthusiasm help support you in becoming skilled, professional children and young people's nurses that provide evidence-based, safe, kind care to the patients of North Wales and beyond. Thank you very much for listening and all the best for the future. Diolch yn fawr iawn am wrando a pob hwyl at y dyfodol.